Hello, and welcome to East Carolina University and ECU Live series as a part of our new ECU student orientation. My name is Lanika Bright, and I'm the director of ECU Student Health, and I'm also one of the nurse practitioners here. And we appreciate you joining us today. Today we are going to cover student health services and what it is we have to offer you. The session will be recorded and will be archived and available on the official ECU YouTube channel in a few days. Please give us some time to get the video captioned and uploaded. In order to make sure that we are following accessibility guidelines, the archive recorded sessions will be closed captioned. If further accommodations are required, please contact the Office of Disability Services. I would like to get started by running through our scheduled time with you. And introducing those who are with me. We will go over student health services, the services that we offer. We will talk about immunizations, insurance, and lastly, we're going to talk about what it is we do, what we're doing specifically for COVID, so that everyone has an understanding of that. With me today, I have Dante Jordan, who will be talking about immunizations. I have Amy Viverette, who will be talking about insurance, and I have Ellen Goldberg, who will be discussing COVID and kind of wrapping up our Q&A session. Please feel free to put your questions in the chat box, and we will be able to answer those at the end of the session. So this is a a picture of our beautiful Student Health Center. We're very proud of it, and we'd love for you all to come and check it out and see what a great place it is. We have two locations for our ECU clinic, student health clinics. One is on main campus, and it's between Joyner Library and the Flanagan Building. Super easy to find us there. Our hours are available on the website, and so you don't have to memorize those for today. But Monday, Tuesday, Thursday, and Friday, we're open from 8 to 5. And on Wednesdays, we're open from 9 to 5. And you will have to excuse the error here. We thought we had deleted this, but we are not open on Saturdays and Sundays at this point. It is Monday through Friday operations. And then in the summer, we're open from Monday through Friday, 7:30 to 5. We also have a clinic on the Health Science campus in the Health Science Student Center on the second floor. And their hours of operation are a little different from ours. They're open from 8 to 1 and from 2 to 5. So because of the smaller staff, they do close for a lunch break. On Wednesdays, they are open from 10 to 1. And that is during the fall and spring semesters, 10 to 1 and 2 to 5. And then on the summer, they're open 7:30 to 1, 2 to 5, Monday, Wednesday, and Thursday. And on Tuesday, 7:30 to 1 and 1:30 to 5. And then on Friday, 7:30 to 11:30. Again, there's no test on the hours at the end of this. And so you can always find those available on our website. When we're not available, we do have an after-hours nurse line to be able to assist students with any healthcare questions or needs that they have. If they dial the main number, 252-328-6841, it can be called from anywhere. The nurses will be able to answer any questions or concerns. And if they feel it is necessary that a student seek immediate care, they will refer them to the local hospital or local urgent care. Our local hospital is Vidant Medical Center. And so we do encourage students, if they have any after-hour questions after hours or having any symptoms, concerns, they will to call the after-hours nurse line, and they will help them kind of decide whether they need to, it's something they can take care of on their own, if they need to come in the next day when we're open, again, or direct them to emergency services. I always get excited when I talk about the services we offer at Student Health. A lot of people just think of us as a doc in the box and don't realize all the things that we do. We are a primary care provider. Just like the things that your doctor's office does at home, your primary care provider, we're able to do the same things here with a few caveats. We feel like we have a few more services than most primary care offices do. So again, we offer primary care. We do have a laboratory in-house. We have radiology. We do have ultrasound. We have a pharmacy. We have sports medicine. We also offer travel clinics for those who in non-COVID times are able to study abroad or to travel abroad. We do offer gender affirming care. We do have psychiatry in-house this year, and so that's new and exciting for us. We offer nutrition services. Students who are getting allergy shots routinely, we're able to take those over here at Student Health. So we do have an allergy and immunization clinic. If your student desires that, or you desire to get allergy shots here, please contact our office and we will help you. Now, the reality is we hope that throughout the 4 years or whatever time span that students are with us, that everything goes well and they don't have any issues. But the reality is sometimes things happen. And so because of that, we want to be prepared in case something were to happen to your student. So we do offer services to assist with any traumatic events that students may experience, whether that is a physical assault or sexual assault. We do have services here to assist them with that. And we also do sexual assault examinations. Again, we hope your student or you would not need those services, but they are available. For things that we don't do here, as you can see, we do a plethora. We have a plethora of services. For something we don't do, we do referrals to local healthcare providers as needed. Our health science campus, because it is a little smaller, our health science center, because it is a little smaller, we do offer primary care there, laboratory services, referrals, and an immunization clinic, with the other services being offered. We have a very large staff at ECU Student Health. Again, we have our staff is made up of physicians, nurse practitioners, physician assistants, our nursing staff. We have a registered dietitian who at this point is also a counselor, so she's able to do some counseling services. We have insurance staff, our x-ray technician, and our ultrasound tech. Laboratory technician, pharmacist, and immunization staff. And so our staff, like I said, is pretty large. There's about between 60 and 70 of us. So we're running a pretty large operation here at Student Health. To get an appointment with us, we do have an open access system to help ensure that people get appointments for same day. I will tell you, when I first started here, we did not have the open access system. So a student may be sick today, call to get an appointment, and we'd be scheduling people 2 weeks out. And so you'd be better pretty much by the time your appointment was available. And so realizing that was an issue, we were able to change our scheduling system so that students can get appointments, can get an appointment on the same day. Those appointments can be made in person at Student Health, by the phone, or online. I will encourage you and your student, if they're feeling bad, to please make that appointment as soon as possible. Our appointments fill up pretty quickly. By most days, 10, 11, 12 o'clock, our schedules are already full. And so we do encourage people, when you get up and realize you're not feeling bad, go ahead and make your appointment so that you can be seen the same day. If our schedule is full, and or for people who are having urgent issues, we do have triage care in-house. So if someone has a laceration, vomiting, an injury, a fever, we do have triage care available where they can come in and they'll be seen by the nurse. The nurse will then assess them and help them figure out, is this something you can take care of at home? Is this something we could wait till tomorrow for? Or do you need to be seen immediately? And if so, they will put them through their triage care provider. Lastly, we do have some over-the-counter medicines available in our pharmacy. Students are free to come in and talk with one of our pharmacists to get recommendations on what self-care things they need. Our appointments, we see on average about 200 patients a day, and during flu season, which I guess now we're COVID season, but during flu season, we can see up to 300 patients a day. So we are rocking and rolling pretty much always in our clinic. The services we provide physicals, we provide care for upper respiratory infections, some elective procedures as well, mole removals, that kind of thing. We care for skin problems, any GYN concerns, any injuries, we take care of those as well. We do offer other contraceptive procedures that would be included in the elective procedures, whether it's IUD placement, Nexplanon placement, long-term care for long-term medical problems, chronic illnesses, anxiety, depression, diabetes, hypertension. We have a clinic that we provide testing and counseling for STIs. We have a clinic where students can make an appointment if they're not having symptoms and they just want to be tested, where they can come in and use what we call the fast track. We do pregnancy testing and referrals. And then we have, again, non-urgent mental health care problems. We provide care for those, and then also, again, just to go back to what we use our triage care for. Triage care is for any acute injury or pain someone may be having. If they've got an illness and they have a temperature, any lacerations, fainting, chest pain, panic attacks, burns, abdominal pain, bleeding, any of those things, as you can see listed on the chart, that's what triage care is for. I'm going to be honest with you. Sometimes there are students that just feel they strongly need to be seen, and we will ask them to go through our triage care if our appointments are already full. And so what we always say is, don't think just because our appointments are full that your student, if they feel that they need to be seen, or you feel that they need to be seen, that there's not an option. Triage care is always promised to or offered to them. So for many of you, you have taken care of these, your children, or if you are the student, you have been under the care of your parents for these years, and you are their babies, and that is the way it is. But you, once you turn 18, are officially an adult when it comes to different things like the law. You are an adult, and so whereas you've gone to the doctor with your parents, or parents, you've taken your daughter or son to the doctor, and they have shared everything freely with you. That no longer happens when your child becomes 18. So at 18, all of that stops, and we are not able to share their private medical information with you. Unless that student were to consent for that to happen. The only other time we would do it without their consent would be if the student was if there was a case of an emergency, we would share that information freely with you. What that means is you may be paying the bill for their visit here at Student Health, and unfortunately, we still cannot share that information with you. So that will be something that you will have to talk to your student about, how you all will navigate that process, and making sure that your student, and if you are the student, making sure that you have open communication with your parents regarding the ability to share healthcare information with them. Student health, your student health service fee that you pay in your tuition covers the office visit and some of the services that we offer at Student Health. But just think of it as like the copay for your doctor's visit. All right. So if you think of it as your copay for your doctor's visit, then that will help you kind of frame some of the things that we'll talk about next. So your student health service fee covers the actual office visit, but there are some costs that students will incur when they're at their visit. Any ancillary service we offer, whether it's lab work, if you're getting a prescription, any orthopedic equipment, procedures that we do, any x-rays, any ultrasounds, those things do carry a cost with them. And so students would be required to pay for that. We are in network with Aetna, Blue Cross Blue Shield, MedCost, and United Healthcare. And so we were able to file those insurances for students. We are able to courtesy file for other insurance companies, excluding Medicaid and TRICARE. We are not able to courtesy file for those at this time. We're definitely working on a way to be able to do that. But at this time, any of the major insurance carriers were able to courtesy file for students. Our pharmacy is a little different in that they can accept more insurance companies than we do. And so one of the ways I like for people to think about that is that think about our pharmacy being like a Walgreens inside of our clinic. So maybe we don't accept that insurance or aren't in network with, our pharmacy might be. And so just because we don't take TRICARE, our pharmacy does. And so you can go to the pharmacy and get your prescriptions with your TRICARE. So remember that when you're thinking about it. So just don't think that because you don't have student health insurance, because you don't have TRICARE, because you don't have Blue Cross Blue Shield, you can't be seen at student health. You can. It's just that, or that you can't use the pharmacy, because you can. So please, if you ever have a question or concern about that, reach out to us and we'll kind of talk you through that process. One thing I would like to mention, in going back to privacy laws, is that students who are under the age of 18, you are not considered an adult, and we do have to have a consent form in order to be able to provide you care. So even if you come in and you just scraped your knee and you want us to give you advice, by law, we can't touch you. So we do need, if you have received a document saying, hey, will you please fill this out and return it to student health, please do that, so we'll be able to easily care for your child or care for you. All right, I'm going to hand it off now to Dante. He is going to talk about the immunization requirements.
All right, good morning, East Carolina University. Good morning, Pirate Nation. My name is R. Dante Jordan. I am the immunizations coordinator for the university. First thing I wanted to go over are some important dates. July 31st, 2020 is the immunization records due date. All records must be submitted to our office on this particular day. It's very, very important that you do get all of your records in completed by this date, August 3rd, 2020. There will be a $100 fee charge for all immunization records received after this date. Unfortunately, that's the unhappy part, but that's the date set for that. September the 11th, 2020, students administratively withdrawn from the university for incomplete immunization records. So it's very, very important that you do get your records in a timely manner. So that's where we are with that. Next slide, please. All right, requirements. All immunization records are required to be submitted in or translated into English. Include your full name, date of birth, the banner ID number on all pages of your documents. Now, per North Carolina law, students will be withdrawn, as before stated, from the university 30 days after classes begin if these immunization requirements have not been met. So it's very, very important that, again, that you do get your records in as soon as possible. Next slide, please. Next slide, please. All right, so the requirements. All right, college university vaccine requirements and number of doses. So the student will have to have at least one of the Tdap doses, and then two, the diphtheria, tetanus, or pertussis, or the TD, but altogether at least 3 tetanus would have to be on your record, 3 polio if you are 17 and under, 2 measles, 2 mumps, and 1 rubella is required as well. Now, the hepatitis B is required if you're born on or after July 1st, 1994, and also the varicella is required as well if you're born on or after April 1st, 2001. There are 2 forms that have to be completed in the My Pirate Chart portal. One is the tuberculosis screening questionnaire. That is not the actual vaccine for tuberculosis, but it's only a screening that has to be completed by the student. And also the reported medical history that has to be completed as well to give us a better understanding of your family history so we can better treat you as a patient of student health services. Next slide, please. All right, now the following are the recommended vaccines, which is in section B on that form that we provide. The following are strongly recommended for college students, but not required. The meningococcal vaccines, A, C, W, Y, and B. For meningitis, the pneumococcal, HPV, influenza, and hepatitis A. Now, these vaccines are not required, but they are strongly recommended that students would have these on their records upon entering the university. Next slide, please. Acceptable records of immunizations. Records may be obtained from any of the following. This is important. High school transcript records. Now, these records do not transfer automatically. You must request a copy. So if you are at a particular high school and they know what university you're going to, they are not going to forward us to records. You must request a copy. Personal shot records must be verified by a doctor's stamp or signature or by a clinic or health department stamp. I do know that some parents have a baby book and they pretty much detail their children's immunizations, but that's all that they do is detail it. If it does not have a doctor's stamp or signature or a clinic health stamp, then we cannot accept that. The local health department records are acceptable. State immunization registry records are acceptable, and typically they have the clinic seal, the state seal on that record as well. Military records or World Health Organization records are accepted as well. Now, if you have attended a previous college or university, we can accept those records, but they do not, again, transfer automatically. You must request a copy. Completed immunization records signed by a physician, nurse practitioner, or physician's assistant. Now, the form is not required if you have those records from the above listed sources. So you don't have to have the form filled out that we provide and turn in a copy of a record that you already have. Next slide, please. Submitting immunization records. Upload them into the MyPirate short. That's the preferred method that we're asking students to upload records and submit them. You can find that. The link is listed right there on the slide, ecu.medicatconnect.com, where students are able to go in. If you have a save file, you can upload the file there. If you can take a picture of the record and you can upload it that way. Of course, we also have students to know they can fax records in as well at that number there, 252-328-4007. You can also mail the records into our office. Now, when mailing records into our office, it takes a little bit longer to process, being that they come to the post office here in the city and then to our post office here on campus. So typically, it takes a little bit longer to get those records processed. You can also email them to immunizations@ecu.edu. Or if you want to come by and visit us, you can just bring the records into our office. If we are closed, there is a drop box, a locked drop box that is outside the door to the right of the front door for your convenience. Next slide, please. Exemptions. There are 2 exemptions that we do recognize here at the university. The first one is the medical exemptions, but they can only be requested by a physician that's licensed to practice medicine in North Carolina. Now, if that physician determines the need to request a medical exemption from a required immunization for a patient and they need assistance, they can contact the North Carolina Immunizations Branch at 919-707-5550. There is a form that is available at the link below that you can take to your doctor's office to have them complete, and we will file that medical exemption for you in our office. Secondly, there is a religious exemption. There is not an actual form that we have in place for that, but you are able to claim a religious exemption. The parent can just write a statement of their religious objection to the immunization, including the name and date of birth of the person for whom the exemption is being requested, and this statement would then be provided in place of an immunization record. We will also file that in our office as well. If you are a family that's requesting a religious exemption, you would have to still complete a separate statement for each child. And again, you can find that medical exemption at the link below. But if it's a religious exemption, you can just type that or write that and just send that into our office. Next slide, please.
I think that's all.
Is that it? All right.
I think you're good.
All right. Thank you. And welcome to the university.
I'm going to take a little break here for just a second and let's get our other presentation up real quick.
Okay.
So if you'll second. Right back, we've got insurance information next. We can get us back where we were. Okay, I'm going to turn this over to Amy Viverette, who's going to share some insurance information.
Hello, my name is Amy, and I'm going to talk a little bit about the health insurance requirement required by the UNC system school, UNC system. Beginning in fall 2010, UNC system implemented what's called hard waiver insurance requirement. This requires any student meeting a certain criteria to have health insurance. Eligible students are automatically charged for the student health insurance plan that's offered by the UNC system on their tuition bill. Students will need to act by either waiving out or enrolling in the plan. In order to waive out, students must have current credible health insurance. On this slide, you'll see the list of eligibility requirements for students, for undergraduates and graduates. I'm not going to read these to you. This is our normal. During COVID-19 times, the requirements have changed a little. The UNC system does realize that there's a lot changing on all of our campuses almost daily, almost hourly. And so they've made some exemptions, some exceptions to the requirement for health insurance for the students that are required to have health insurance, for the students that are required to do a waiver if they have their own insurance, or for the students that need to purchase insurance, their eligibility. They've kind of relaxed a little on the eligibility requirements due to so much changing on campuses. Many of our classes have been moved to an online format due to the social distancing criteria. So for fall 2020, the requirements for health insurance or the requirement to either waive or purchase hours is to meet the required number of hours. For undergraduates, 6 credit hours, or graduates, 3 credit hours. They must be enrolled in degree-seeking program and pay the health service fee. Under this, I've added an insurance email address. So if you need to purchase the student health insurance plan, but you find that you're not eligible, you find that it's not automatically on your tuition, if you would please send an email to studentinsurance@ecu.edu to confirm your eligibility, and then request that the student health insurance plan premium be added to your account, we can aid in the process of getting you enrolled in the insurance. If you'll send the email, include your full name and banner ID, we can add the charge to your tuition. Once the charge has been added, then you can proceed and enroll on the Student Blue website. You have to enroll or waive once the charge is added, and then you would have active coverage. Again, any questions you can just send to that studentinsurance@ecu.edu. And this is for students that the charge hasn't automatically been applied to their account. Cost and coverage for the student health insurance plan, we actually just got confirmation yesterday that the North Carolina Department of Insurance has approved the policy cost for this year. The total annual cost is $2,616.80. That's $1,308.40 per semester. This plan does provide 12-month of coverage, but they break the plan into semester payments, so that way it's for, eligible students. It's billed in the fall and it's billed in the spring. Financial aid can be considered for this required for health insurance, since it is a required fee. It is required that you have it. Health service fee covers acute provider charges at student health, while SHIP covers the medically necessary charges, lab, x-ray, pharmacy, etc. Students must be registered for classes to take action. I can't tell you how often we get a phone call, I can't enroll, I can't complete my waiver yet, and that's normally due to the student hasn't registered for classes yet. So once they register for classes, if you give us about 48 hours, normally the student can then go onto the website to complete a waiver if they have their own insurance that they're going to continue to be covered by. The deadline for enrollment or waivers, the deadline for fall is September the 10th, and the deadline for spring is January the 31st. This is a hard date. So if you want to waive out of the student health insurance plan and it's on your tuition, please make sure you complete a waiver prior to September the 10th. Okay, and next I'm going to turn it over to Ellen so she can provide the COVID update.
Hello, my name is Ellen Goldberg. I'm the Associate Director for Clinical Operations, and I get to talk a little bit about the topic that's on everybody's mind right now, and that is COVID. We wanted to share a few updates with you about things that are going on with student health and how we are planning to help keep students safe in the fall. We've got a few updates about our own facility that I wanted to share, some things that we've implemented for when students come to visit us for services that helps keep them and our staff safe. We have a few new things such as mobile self-check-in. That is the student's ability to check in on their phones. That keeps them from having to use a community computer to check in or having to have a lot of close contact. They can check in on their mobile device, sign forms that they need to sign, and then we know that they're ready for their appointment. We also have some telehealth visits for some appointments that enables the students to see us virtually. We're using that for convenience for students. And then also in the fall, we have some appointments that they'll be able to make via telehealth. And that will help serve the students in a more convenient manner and also provide services where they don't have to actually come into the facility. So that will be really nice. The separate sick and well waiting areas is also a new, we do it sometimes for flu season, but now we're doing it all the time. We actually have separate areas where students can wait depending on what they're seeing us for. That helps keep our sick students and our well students physically separated. We're also doing the same thing with our exam rooms and our exit. And that helps minimize contact between people. So that's another social distancing step that we have taken. We do have some barriers like you've seen probably at other facilities and in retail establishments that help keep our staff safe. You will see masks, just like masks on campus. We do require students wear masks inside of student health, and our staff wear masks as well. And then we're also doing frequent cleaning breaks. We are building in more time for our staff to really do thorough cleaning of different surfaces, more so than we normally do for regular flu season, because we recognize the need to be sure that those commonly used surfaces are cleaned and sanitized often. We will be helping students as they return decide what is considered an exposure. That's a question a lot of people have. Do I need to be worried? Do I need to be tested? One of the things we do is help students understand what an actual close contact is with someone with COVID. So you can see the examples that we have there. These are from the Centers for Disease Control. And we will talk with students if they have a concern about whether or not they should be in quarantine or they should be tested. We're happy to talk with students and help find out exactly what happened, how close were they with someone that had COVID? Does it meet the qualifications for being someone that we would be concerned about and that would be at higher risk? We do also help the students understand the difference between quarantine and isolation. We hear those terms a lot, frequently on the news. Sometimes they're used interchangeably. They actually mean different things. And so we will talk with the students if we think they need to be in quarantine, which is when we tell someone to stay home because they may have been exposed and can share the virus with others, versus when someone is sick and we want them to isolate. That means that someone is infected with the virus and we want to keep them away from anyone else that could be infected. So part of our role at Student Health is to provide education and to help counsel the students as to what a risk is and what an exposure is. We'll certainly be doing that in the fall. We do have testing available, and that's also a question we get frequently. We do see testing appointments. We do not have walk-in testing at this time. We are seeing students by appointment for different indications for testing. Certainly students that have symptoms of COVID, students that have had a risk exposure, as I mentioned before, someone that we are concerned has been in close contact someone with COVID, we certainly would counsel them appropriately about the possibility of testing. And then students that are in academic areas or programs where they are needing to be tested for clinical contact, for example, we're working with those departments to help get those students tested. The test is a nasopharyngeal swab, which is just a fancy way of saying it's a thin swab that goes inside the nose, back to the throat. It's not a very comfortable procedure, but we do try to do it as quickly as we can and help the students relax by telling them what's going to happen and help them prepare. The test cost is filed to insurance. If you have an insurance that we are participating with here at Student Health, or it could be self-pay. Any charges that are unpaid by insurance, we would charge to the cashier account. And the results are usually coming back in about 1 to 2 business days. So that helps us with giving students the appropriate advice as far as quarantining and isolation. So you may have heard some things on the news about different return times, but we're pretty pleased that ours come back in 1 to 2 business days from our testing. We are also tracking students. So if a student tests positive for COVID, either here with us at Student Health, or if they report to us that they've had a positive test done somewhere else, we do make frequent contact with that student. We check on them, we check about their symptoms, we offer medical care if we feel like their symptoms are worsening, we offer education about how to successfully isolate or quarantine and what they need to be doing or not doing during those periods. And then we also can connect them with other university resources. It's important for students to reach out to us if they have questions, and I'll give you a contact slide here in just a minute. There's lots of different ways students can reach out to us, and we're happy to help them try to figure out what their risk is or help them answer questions about COVID-related issues, testing, exposures, and things like that. We do have some advice on what to bring to school when you drop your student off. Just a basic little kit, almost like a first aid kit, is recommended. A thermometer is great to have, particularly now with COVID. One of the things we will want to know is if a student has had a fever. So giving them a thermometer is a great thing to have in a kit. Some basic over-the-counter medicines, something like Tylenol or ibuprofen to help with aches and pains and fever. Band-aids, some small first aid supplies like antibiotic ointment, a list of current medications or allergies, certainly their current insurance card. And then we do recommend maybe a little sick day kit of maybe some soup or Gatorade, ginger ale, something like that, and some crackers. When students don't feel well, it's nice if they already have a few easy to prepare things in their room or in their apartment that they can grab quickly to stay hydrated and to get something on their stomach. So we do have prescription and over-the-counter items at the SHS pharmacy, and they can be purchased with HSA cards. So keep that in mind if you want to get some things when you arrive in the fall. We have a lot of those items available. This is the contact slide I mentioned. We have lots of ways for students to contact us. We do have a email service there, gotquestions@ecu.edu, and that is for general health questions. So if they have questions about COVID or questions about services or anything related to student health, please have them email us. We cannot provide diagnosis through that email, but we're certainly able to help them navigate their questions and get them some answers. We do have a very comprehensive website, and we are very active on social media. So you see our handles there for Twitter, Instagram, and Facebook. We would encourage students and parents to follow us on social media. We put out a lot of information about deadlines and other important things that students and parents need to know. We also have My Pirate Chart, which is the students' online health portal. They use that portal to make appointments online, to receive their lab results, to see walkout statements from their visits that they've had here. They can also upload their immunization and insurance information. And so that's a great site for students to become familiar with. That is also the site that they check in on when they come for mobile check-in, and they have forms that they can fill out. So there's lots of ways they can contact us, and we encourage them to reach out with any question. That is all for what we had written for our presentation, kind of the highlights of the information that we most often get questions about and wanted folks to know. We'll be glad to answer some questions now. I think we have some questions on the chat and on the Q&A. And so it looks like we have a question. If you waived the student blue insurance and have your own personal insurance on file, are these services still applicable to us? I'll be glad to. And you want to answer it? Student health is for every student. Students pay a fee on their tuition, and that enables them to use our service whether they have insurance or not. Students that don't pay fees, that may be taking classes online, still have access as well. If they are enrolled, they have access to student health services. So we want students to understand that no matter what their insurance coverage is, the services that we have available are available to them as well. It just makes a difference when we talk about at the end in terms of payment and reimbursement. And so we're happy to answer questions. If a student has a question about specific insurance coverage or what services may or may not be covered by their plan, they can certainly reach out to us, and we're happy to take a look at what their coverage is now and explain to them what that means in terms of having services. But yes, we want everyone to understand that even if you waive the insurance or if you have a coverage that we are not in network with, student health is a great option, and we can serve the students conveniently. And all of the students, all the services that we have mentioned are certainly available to any enrolled student. Looks like we also have a question. Do you do sports physicals for club sports? If yes, what is the process for making an appointment? We do physicals for all types of issues. So yes, we have a variety of types of physicals that we do. And the best procedure for making an appointment is to have a student give us a call so that they can let the appointment personnel know what the physical is for. The staff can give them a little bit more guidance in terms of what an estimated cost might be or what lab work and things might be associated with that type of physical. And so if a student wants to make an appointment, we encourage them to call. We're not scheduling yet for fall. So if this is a student that's coming in the fall, we would encourage them once they're here in August to go ahead and reach out, and we can get them set up for that physical appointment. I don't see any other questions on the chat. Corey, if you know of any. I don't. SHS submit insurance claims, or does the student need to submit the claim? I'm going to let Amy take that since insurance is her. I'm going to slide over and let Amy answer that about submitting claims and how that works at Student Health.
We'll submit claims for insurance companies that we're in network with and also out of network with. Like Lanika discussed earlier, the only claims that we cannot submit are claims through like government coverages, Medicaid, Medicare, TRIAGE. We are working to get contracts with Medicaid, with North Carolina Medicaid and TRIAGE. However, we can't file any other government coverages at this time, and definitely no out-of-state Medicaid.
Okay, let's see. For students who test positive and are in apartments, how will they get food and medications? I'm going to let Lanika take that one, so she can answer that question.
Yes, so any student who is living in off-campus housing and is diagnosed with COVID, we encourage the student and parents to come up with a plan of how they will get food, how they will get medicines, that type thing. And so I think it's really important for families to plan on their student getting COVID. And I know that sounds horrible, but if you have a plan in place when it happens, then you will be able to function. So it's important, really important for those parents and for the students to work together and figure out a plan. If you're not living in campus housing, you'll need to figure out a plan of what you will do if your student were to become sick, how they will get food, how they will get medications. If they're diagnosed here, we will do our best to give them medications they need before they leave our clinic. However, if they're not diagnosed here, they will need to have those. So thanks. Oh, sorry, I wasn't clear. I mean, students who are living in the dorms. Okay, that is different. And definitely check with campus living. I am now just reciting to you what I've heard from campus living, so you will want to have more of that, a conversation with them about that. My understanding is there is a plan for campus dining to deliver meals to those students who have been moved to the isolation apartments. I would encourage you to talk more with campus living about that, but that is our understanding, that they will have meals delivered.
Okay, let's see. Do we have any more? I don't think I see any more quite yet. I don't want to miss anybody, so. Okay, I don't think this last call for some questions. If you have questions after this, please don't hesitate to contact us. We'll be glad to expound on some of the things that we mentioned. So thank you for joining us today. As a reminder, this session has been recorded and an archived copy of the recording will be available on the official ECU YouTube channel. We hope you'll join us for the next session, which is at 1 p.m. That's the Office of Student Rights and Responsibilities. And again, please reach out to us. That got questions at ecu.edu is a great general email that we're happy to answer all kinds of questions, or give our office a call if we can help with anything else. And we're glad to welcome your students in the fall. And if you need us, please reach out. Thank you so much and have a wonderful day.